Okay, here we go. Next item is the agenda. I'm going to put the agenda in the chat, and then we will have introduction. So, excuse me while I pick up my agenda. So the agenda is in the chat. You should be able to read it. Basically, we are looking at discussing three things: the health industry globally, plantations in particular countries, Sri Lanka and Malaysia and India, and Ansell Lanka, right? So the actual two factories of Ansell that are in Sri Lanka. That was what we were aiming to discuss 1 month ago. And two things have come in the way. Number one is the war in Ukraine that has changed priorities for many activists and their activities. Number two is the increase in the price of oil that has caused dramatic crisis in many countries, including Sri Lanka. So there has been a state of emergency called, and there's people in the streets everywhere. And Shashini will talk about that in a moment. So I don't know what we will do with this agenda. We will discuss what we do with the agenda, but first we're going to do introductions. So if people want to read the agenda, it is in the chat. I'm going to go to introductions following the way we do it. So it's the way I see people on Zoom. So in introduction, please just say who you are and where you're from, and please also say what city you are in if you can. Okay. Comrade Stefan, you are first today.
Thank you. My name is Stefan Chaluka. I am Secretary of Rochdale Trades Council, and last week we passed a motion at the Northwest TUC conference in support of Ansell workers and the Solidarity Campaign.
That's fantastic. Thank you, Stefan. So the city you are in is Manchester, yeah? Manchester. Okay.
That's right. Yeah. Greater in the conurbation of Greater Manchester. There's 10 boroughs that make up the whole of Greater Manchester, and Rochdale is in the north of Greater Manchester. Yeah.
Thank you so much. Next is me. So my name is Manrico. I am chairing this meeting. I am co-convener of this campaign appointed by AAWL. Co-convener together with Comrade Gwyneth, who is in the room. I am on the executive of Australia Asia Worker Links, and I am a member of the University Teachers Union in Melbourne, Australia. That's where I am, in the dark because it's light here. Jean-Pierre, you are next. Jean-Pierre?
Yeah. My name's Jean-Pierre Varois. I'm based in Paris, France, and I'm here on behalf of the International Workers Committee for the Workers International, and we are involved in the campaign in defense of Ansell workers. And we were also active in organizing last Sunday an emergency international conference against war. And that's it. And if you don't mind, I will put the final appeal in the discussion box in a few moments.
Yes, thank you. Some comrades, we had publicized the conference. I know some comrades from here, including me, went to that meeting. It was very interesting. Thank you. Thank you, Jean-Pierre. Next, Philip.
Hi, everyone. My name is Philip Wong. I'm from Kuala Lumpur. I am with the Workers' Bureau of the Parti Socialist Malaysia. We are here. My compatriot Irene Xavier, who has been attending many meetings, is busy hosting a forum with migrant workers this evening or afternoon.
That's great. Thank you. Thank you so much, Philip. Jonathan, you are next.
Thank you. Good morning, everyone. I'm Jonathan Fluxman. I'm a retired GP. I'm a member of Doctors in Unite, along with Coral Jones, who you know. Unfortunately, I haven't been able to attend these meetings until now, but my commitments have changed, so I'm hoping to be able to attend. And just to thank everyone for the great work that they've been doing. Thank you.
Thank you so much. Thank you for coming to the meeting. Coral, you're next.
Hi, I'm Coral Jones. I'm also from London, from Doctors in Unite, also a retired GP. And my contribution so far, I think, to this campaign has been to try and reactivate the energies of the British Medical Association and now the Public Accounts Committee in the Parliament about exploitation of workers in the PPE supply chain. They write great things, but actually getting them to do anything is the next thing. And Manrico's going to send some information through to them. So, and I think our next, Jonathan and John Dale, who gives his apologies today, I think our next thing is to get the international section of Unite involved, because they support trade unionists in various countries around the world. Thanks.
Thank you, Coral. Gwyneth, you're next.
Hello, comrades. I'm a co-convener of this campaign together with Manrico. I am also a Vice President of Australia Asia Worker Links in Melbourne, Australia, and I am a member of the Meat Workers Union. Thank you.
Thank you so much. Jeremy, you're next.
My name's Jeremy Small. I'm part of the Committee of Management of Australia Asia Worker Links here in Melbourne.
Okay, thank you, Jeremy. Next is Brian.
NHS supply chain. Oh, hang on. Oh,
yeah, I can hear you now.
Sorry. Use the branch section NHS supply chain in Derbyshire in the middle of England. And if Gemma's not on, then obviously from Unison International Campaign, we're trying to promote the campaign within Unison, the public sector union in the UK, to the best of our ability.
Thank you. What city did you say you're in, Brian?
It's a county, Derbyshire.
Thank you.
That's a larger area. It's not. I don't live in a city like yourself.
Okay. Thank you so much, Brian. Okay. Next is Michael.
Thanks. Hopefully you can hear me okay. My name's Michael Waits. I'm the Acting Assistant General Secretary of the New South Wales Nurses and Midwives Association. My substantive role is Director of Strategy. I'm pleased to be here tonight. I'm in Sydney, Australia.
Thank you. Welcome. Thank you so much for coming to this. Next is Aga. Welcome back, Aga. We've missed you.
Thank you very much, everybody. My name is Aga Abdul Sattar. I represent to North-South Initiative as a case manager, community developer, senior social worker for migrant and refugee workers here in Malaysia. Thank you very much for having me here.
Aga, you are here with two different devices. Is that correct?
Yeah, because my laptop's audio system not working well, so that's why.
Problem.
Can I leave? Yeah.
No problem.
Yeah.
No problem. I just need to check. Thank you.
Yeah.
Next is
Thank you very much.
Anisur. Welcome.
Thank you. I am Anisur Rahman Khan, a returning migrant. I am a Bangladeshi. I am the Director Migration Awas Foundation, as well as I am the Executive Director of IMA Research Foundation. IMA is International Migrant Alliance. And I am the ICB member, International Coordination Body, a member of IMA Global. IMA Global is a global network of migrants, refugees, and displaced peoples. And I am also the member of Bangladesh National Migration Forum. This is government instituted organization. Thank you.
Thank you very much, Comrade Aniso. And next is Sylvester. Sylvester, we are so happy that you are in the meeting. Welcome back.
General Secretary of the Ceylon Mercantile, Industrial and General Workers Union. I wish to contribute whatever I can at this meeting.
Thank you. Really happy that you are here and good to see you well.
Right.
Next is Shashini.
Hi, I'm Shashini. I'm from Sri Lanka and I'm a member of Stand Up Movement Lanka.
Thank you so much, Shashini. And then Sinia Jackson Brett.
Hi, hello. I'm Sinead Jackson and I'm a university journalism student at the University of Essex, and I was advised to come along by my lecturer, and it's a campaign I've not heard much about before, so I'm excited to learn more about it and become more enlightened. And I'm in London, by the way.
Okay, thank you. Welcome to the meeting. So this is that's the introductions. If more people come in later, we will not introduce them. They will just come into the meeting. There is in the chat, there is the link that Jean-Pierre said about what the appeal against the war in Ukraine. Okay, so you can pick it up from the chat if you wish. So we are now going to look at the agenda. So I think we have enough people for the agenda to go as planned, but I just want to discuss with comrades what we're going to talk about. So this is, I'm going to put the agenda again. The reason I put it again is because Zoom doesn't let people who come in late read the agenda. They don't, they're like this, they're like old school. So I'm just going to put the agenda back. So the agenda, I'm going to read the agenda very briefly. So the first, we wanted to cover 3 areas that we have been campaigning on from the beginning of the campaign, but now that there are so many people involved in the campaign, even though there's a few people in this meeting, there are so many people involved in this campaign over, I think, 15 countries. So we wanted to just get an assessment of where we are. So the first part we want to discuss is the health industry. So what we said is, after years of being expected to work under extreme pressure and dangerous conditions, health workers are taking industrial action in Sri Lanka, Malaysia, Australia, and UK. We have some health workers here, so they will need to share their time to give the reports, because we didn't know how many people we would get. So however many people want to speak will have to share their time on this. What we want to cover is, we want to discuss the current situation, the workers' demands, and their request for solidarity. Okay, so that is basically what we're focusing on. The second item we want to cover is plantations. Now, we have had a plantation workers union from Sri Lanka continuously participate in the meetings, but they're not here now because of what's happening in Sri Lanka. So I don't know what we will do. Comrade Anisur, do you have any information on plantations?
Sorry, unfortunately, I have contacted some workers, but plantation workers, they are working in remote area. They told me this time they could not available on our Zoom meeting, but they assured next time they will try to participate our program. I'm really sorry. They cannot add here.
There's no need to apologize. Thank you. The fact that you contacted the plantation, this is plantation workers in Malaysia, is that correct, or Sri Lanka?
In Malaysia, Bangladesh, my plantation workers in Malaysia.
The fact that you contacted them is great. So if we can follow up, that would be great. So we don't have plantation workers in the meeting, is that correct? Anyone who's a plantation worker, please wave. or jump up and down? No. Okay, so what I propose is that the plantation part of the meeting is just handed over to the comrade from Sri Lanka. So Shashini will start, just give a brief explanation of what's happening in Sri Lanka. There are other comrades now from, no, there's only one more comrade now from Sri Lanka, who is Comrade Sylvester, who may want to say something. But that is what I would put in instead of the plantation item. And then the third item is Ansell Lanka. So this campaign started with Ansell Lanka. The workers from Ansell Lanka who have been in the campaign cannot manage to come into the meeting because of the power cuts in Sri Lanka, so they cannot turn on their machine, the computers to come into the meeting. And in any case, many workers are just on the streets, as Shashini said. So that's where we are now. So we are going to ask Comrade Sylvester to speak. I don't know how much information you have, Comrade Sylvester, but you are the representative of industrial in this meeting. So you can say whatever you think about the situation, where we should go. Anyway, I'm going to put Comrade Sylvester first, if that is all right, on this item. Would that be okay with you? Yes, you said yes, or you said no? I didn't hear it.
I will participate here.
Yes, thank you. Okay, so what I want to do now is I want to change the items on the agenda. So we will keep to the same agenda, except we are turning plantations to a brief report on the situation in Sri Lanka. So I would like to put that number 1, and then put health number 2, and then Ansell Lanka 3. Would that be okay with the meeting?
Yeah.
Okay. So each item is meant to be about 10-15 minutes. So we are not going to go on and on and on. So this is just basically to give reports and have a little bit of discussion. And then at the end of the entire meeting, at the end of the 3 items, we will decide what we are going to do next. There is another meeting scheduled, which will in May. We will talk at the end of the meeting whether we go with the schedule or whether we change it because of the disasters that are happening in the world. Okay, so are people happy with to change the agenda to make it Sri Lanka report number 1, health industry number 2, and Ansell Lanka number 3? I would like people to vote. Yeah, people are saying yes, yes, yes. Some yes votes, no votes. Okay, we go with that.
Yes.
Okay, thank
Yes.
you. Okay, so the first item is report on the situation in Sri Lanka. So I'm going to ask Shashini to speak first for about 2 or 3 minutes, and then we see if Comrade Sylvester wants to say something, and then we have a little bit of discussion, and then we move to the other item. Is that okay? Shashini, you're up.
Yeah. Okay, the current situation is at the moment, Sri Lankan citizens, in spite of their political views or anything, all the people have stepped out, standing solidarity against the president and the prevailing regime. So they want them to step down. So, but still, they have not got any proper answer for that. So the reason for the protest was the fuel crisis, and also currently there are medicine shortages and food crisis and many other issues going on. So people believe that this situation was partly to be the leaders were to be blamed for this situation. So they are requesting them to step down, and then they're expecting a set of new leaders to come up and then start finding new solutions for the current situation in Sri Lanka. So first there was a protest on the 31st of March, which was which came up to the president resident, and there were some issues where the people were attacked, and even the media, and they were attacked. I think everyone would have seen on social media and stuff. Then with that, people were we wanted to speak for these the right of the people to express their views. And then there was a another protest which was organized on the 3rd of April, and then the country was sent to a total lockdown by the government, and people were not allowed to step down to the roads to express to fight for their rights. But still there were people peacefully standing outside holding placards, and they were expressing their views. And then 9th, yesterday, there was a protest in Golface Green, and it's still happening up to now because people's demands are not yet met, and the president is not willing to step down. People want the Rajapaksas to leave, and they want the looted money and other things, and they want legal actions against their rule. So that's the current situation. Meanwhile, and also still we are suffering with food crisis and also power cuts and so on.
Thank you. That is so clear. Thank you, Shashini. Okay, I'm going to ask if Comrade Sylvester wants to add anything to this report.
I think what Shashini said was comprehensive, except the fact that the entire episode started with the scarcity of fuel, gas, and food, milk food also for the children. So the main cause for this, as we have seen, is the constitution of the executive presidency. We have been campaigning against the executive presidency from its inception, and now the results we can see for everywhere. What is the position with the executive presidency? The increase in the food prices have brought in number of issues confronting workers and the trade unions. The youth who are on the streets at the moment for days and days, they are campaigning that the president, whose name is Gotabaya, they have a slogan called Gota Go Home, because he's a dual citizen in Sri Lanka with the American citizenship, and also their family, the Rajapaksa family that is governing the entire situation here. The people have started saying the entire 225 ministers in the parliament should leave. So at the moment we see that the groups in the parliament are discussing amongst themselves, because it is a club that they have to safeguard each other as far
Comrade Sylvester, you hang on.
Be the position.
Who's making noise? No.
Moment, that is all I have to say. And hello.
Yes.
That is what I have to contribute. If it is necessary, I will drop in later. Thank you.
Thank you. So you are going to be speaking on the Ansell Lanka later, but thank you for this. This is very, very helpful. Does anybody want to say something about the general situation in Sri Lanka, just in 1 or 2 minutes? Does anyone want to say something? Yes, Brian wants to say something. Go ahead, Brian. You have 2 minutes.
In one of our local newspapers here in the UK, it's got a photo of Sri Lankan government medical officers protesting outside the National Hospital in Colombo. And there's 6 gentlemen, you know, sort of as doctors. Obviously there's a couple of posters in English, so no medicine, no devices, no fuel, no electricity, no solution. And what they're saying is that unless supplies are urgently replenished, if not with a matter of weeks, if not days, emergency treatment will not be possible across, obviously they're talking about Colombo, I presume they're talking about many other parts of Sri Lanka as well. So despite obviously, you know, obviously in Europe we have Ukraine, photos of this, of what's happened in Sri Lanka, is being reflected in parts of the UK press.
Thank you so much, Brian. That's very dramatic, the statements that you have said. Comrade Lionel is in Melbourne. He was a refugee from Sri Lanka because he was a political activist and he spent a lot of time in jail in Sri Lanka. He has actually put out an interview on radio in Australia, and I am going to put that in the chat, so you will be able to listen to it later if you wish. So that is, I'm just going to put that interview with, so you know Lionel, he has been in these meetings for many meetings. He is not here right now because he's in a meeting with comrades, a Zoom meeting with comrades in Sri Lanka, trying to deal with the protests. So I'm just going to put that. So, okay, does anyone else want to say anything on the Sri Lanka issue, and then Sri Lanka crisis and protests? Okay, Jonathan.
Thanks. So I just wanted to share details of a meeting that was held yesterday, which unfortunately I couldn't attend, here in London, called by the People's Struggle Movement UK, Sri Lanka. It was a demonstration in Parliament Square in Westminster, obviously calling for support and solidarity for the situation in the country. Thanks.
Thank you so much. Yes, we have had some solidarity rallies in Melbourne also, probably many other countries. Okay, anyone else want to say something on situation in Sri Lanka, which clearly is developing? Shashini said that people are still on the streets, so the situation is definitely developing. Yes.
It's raining heavily from last night, but still we see a lot of youth. They have not left the place. They are still they are in the protesting area, Goldface Green.
Okay, thank you. Someone else wants to speak. Who put their hand up? I cannot see it. Oh yes, Comrade Stefan.
I was just thinking, there is a national TUC's conference coming in June. Unfortunately, I was until very recently the Greater Manchester, the County Association Secretary. I've been replaced, but everything seems to be quite amicable. They want to give me a long service medal and all this sort of thing. But the thing is, they have, in the transition, missed the deadlines for the ordinary motions, but I'm sure we could, if somebody would like to draft some kind of emergency motion, I'm sure through Rochdale Trades Council, I could persuade the Greater Manchester Association to submit an emergency motion on Sri Lanka and what and the current situation. So obviously I don't know as much as quite a few people here, but if anybody can pen a motion, I can possibly try to get it circulated and taken as an emergency at the National TUC's conference in June.
Thank you, Comrade Stefan. So I will ask if Shashini or Comrade Sylvester have a motion to send it to me, and I will pass it on. If they do not have it, I will request Comrade Lionel. He will definitely have it, and so you will get a motion tomorrow at the latest. So Shashini, if your organization has a solidarity request, please send to me, or Comrade Sylvester, if you have a solidarity request, please send to me. So if someone else wants to speak. Oh, Jerem wants to speak. We're coming to the end of this item, comrades, because as important as the crisis is, we have to make a little train of crisis situations. So we will finish this item and go to the next item. So Comrade Jerem, your time.
Well, maybe that's a bad time to ask a question then.
No, it's a good time.
Like, obviously it's the most extraordinary crisis in Sri Lanka and the most extraordinary uprising in Sri Lanka. Just in social media, I've seen protests of lawyers, of bank staff, of health staff, I've seen a protest at the, I think I saw a protest at the Biagama trade zone, which is where Ansell have their factory in Sri Lanka. So I was interested in that. The plantation workers have had protests, just every sector. I guess I was curious, like, to what extent, if any, like, have these protests spilled into strikes at all? Like, are people protesting after hours or in their lunch hour, or short demonstration strikes, or are there any more prolonged strikes and worker activity going on? Which
Thank you, Comrade Jeremy. They're very, very good questions. Now I want to know about this too, but I also have to look at the time. So I'm going to get Comrade Anisur to speak next for just 1 or 2 minutes, and then I'm going to ask Shashini and Sylvester to reply if they wish, and then we go to the next item. Are people happy for this? Because I need to keep going, yes? Okay, so Comrade Anisur, you would like to speak?
Thank you, comrade. Give me space again. Being a returning migrant, for a long time I worked in abroad. At that time, I had a lot of good Sri Lankan friends. And after return from my migration, I am working more than 20 years with the migration. And the Sri Lanka has some important contribution towards the migrants' well-being. So in this situation, I am really feeling very bad for BS Sri Lanka. I wish how Sri Lanka can overcome this situation. Thank you.
Thank you, Comrade Anisur. It is a dramatic situation. I'm going to Aga, you want to speak? You're the last speaker, Aga, and then I'm going to go to Shashini and Sylvester, then we move on. I'm sorry I have to do this, but I have to do this. Please speak, Aga.
Yeah, just 1 or half minute I will just, yeah. Now is okay? Sound is
Yes, now
okay?
it's okay.
Yeah. I want to share the current condition of Malaysian migrant laborers and refugee laborers, same from the 40 years, everybody know. But I am worried about that after the pandemic, the new workers, millions workers also coming to Malaysia, but they also going to same systemical problem they getting, but nobody here give them what we call the education about the labor laws and what is the problem here, who is the companies making with them, and also authorities didn't respect the social workers. When the social workers help the authorities, they make the complaints and make the files for a complaint of workers and go to the authority. Authority also didn't help them. They also demoralize them. They underestimate, make the underestimate of workers to totally. I have seen they didn't want to get the reports from the workers. So I have checked the all authorities, but they are not willing to help them.
Okay,
So this is the big problem.
I agree. Aga, so what we have, I didn't discuss the agenda of the next meeting, right? So the agenda of the next meeting has a specific item to talk about the situation for migrant workers, and particularly the situation with bonded labor and the elimination of rights for migrant workers. Okay, so I wish to speak that later. Speak about that later. Okay, because we need to get through the discussion of Sri Lanka and the health industry today. I know that they're all big problems. I know that. Okay, so I want to leave what you are saying up for a bit later. Okay, Aga? I'm sorry. Okay, I'm going to ask, so I'm going to come back to you because we are going to discuss the next meeting. So before we finish, we will discuss this again before we finish this meeting. I want to ask now for Shashini and or Comrade Sylvester to answer what Comrade Jerem said. Is in terms of the uprising, how widespread is it, and is it turning into strikes? Are strike actions happening? How are the workers behaving? Shashini first, Sylvester second.
Okay, so these protests, initially they were starting like in the evenings after work, and most of the people were out in the night, like in the nights, like after work they were there. So even housewives, children, we could also see little children holding placards, and after that, with the incident which happened on the 31st, and when the curfew was imposed on the 3rd, then on the 4th, most of the, even though people were there on the streets on the 3rd, 4th also people came out. Most of them joined sector-wise after work. There was this IT people involved in IT companies. They protested, like they gathered into different places after work, and they were participating in protests. And also, personally, I'm a university student, so now due to power cuts, I'm also facing issues in conducting my research, and it's kind of a very stressed situation. So even university students, there, some of the government university, state university students have they have been given holidays due to these issues. So students have stepped out. They've been protesting all like from morning till evening. But some of the people after work, and also up to now, because of the fuel crisis, I think transportation is also facing some problems. So they've been on the queues to get their fuel and all. So there were issues there. So they've been protesting. Like actually, they couldn't go to, like they couldn't do their jobs, and they couldn't work because of the fuel crisis. So they've been in the queues, and they've been, fighting for their rights.
Thank you, Shashini. Comrade Sylvester, you would like to say something? Only 1 minute left for this item.
Yes, we have already, as the union, we have issued a statement on the 5th of April. As you know, that the university students are in the forefront of the struggle, and the trade unions, as you know, are in different groups, and they're still discussing how we should intervene. But at the same time, the JVP and certain other unions have got together and have made protests. But we are going to have meetings next week to decide what course of action the trade unions concretely can do. That is the position at the moment.
Thank you. Okay, so we are going to move to the next item, just at the most exciting bit. What's going to happen in Sri Lanka? So we are going to have to watch and see what happens, but we need to move to the next item on the agenda. So I would like to thank Shashini particularly. Thank you for stepping up like this without any kind of preparation, because I didn't ask you before. And also thank you so much, Comrade Sylvester, for giving us the updates, and thank you for comrades who are participating in this. We will share the solidarity motions so that unions can put them. Yes, we will send this out. Next, then we now go to the second item, which is the health industry. So basically, the reason health industry is in this meeting is because when we started the campaign on Ansell, we were looking just where we started the campaign was just from the Ansell factory in Sri Lanka, and then we have expanded the campaign following the production line of the rubber gloves, and then finding other parts of the industry that are connected to it. And of course, now we have people involved in the campaign from the very beginning of the rubber glove production, which is the plantations where rubber is grown and tapped from the trees, to the factories, to the transport, and then to the end users, who are mostly hospital workers, but other workers too, like construction workers, manufacturing workers, meat workers, and so on. So we are finding, as we develop the campaign, we are finding that the terrible conditions in the Ansell factories are not the exception. That's what we are finding. They are much more the rule. In plantations, conditions are terrible. In the factories, conditions are terrible. And even in Western countries with proper contracts and everything, conditions are pretty bad. So that's where we are at. So now we The reason we wanted to have a section on the health workers is we would like the health workers to participate, to talk about their situation. The main reason we wanted to concentrate on health workers, to be completely honest, is that the majority of the factory workers involved in the campaigns have very weak unions or no unions, or even worse, yellow unions, non-genuine unions that work for the bosses. So we are trying to identify where is the union strength in the PPE production area from the beginning to the end. And it looks like the union strength is at the end. It's with the health workers and manufacturing workers and maybe transport workers. So there you go. That's the introduction. So who wants to speak on this? There's a few health workers who want to speak, so we will just divide up the time between you. You've got about 20 minutes if we give you as much time as the Sri Lanka item. And remember, there's one more item, which is Ansell Lanka after this. So who would like to speak? So first, do you all want to speak? So there is Jonathan, yes. Michael, yes. Brian, are you speaking for health workers today or not? I can't hear you. Yes. So Brian, that's 3. Coral, that's 4. Is there any others? No. Okay. So so you've got 4, which is about the okay. So whoever wants to start. Coral, maybe I would go maybe Coral first, Michael second, and then the other 2.
I didn't actually indicate to speak. I think Jonathan can speak for me pretty much here.
Okay, I just called on you because you've been more involved in the campaign more, but that doesn't matter. You can pass it on. Up to you.
Thanks. Yeah.
Jonathan.
I'm sorry, Chair, but I don't have anything to contribute. I'm a bit out of touch with the campaign.
No, okay, so I'll start again. This is why I went to Coral. Sorry, you don't have to talk about the campaign. What we are asking here is to talk about the situation for health workers. The health workers are at the end of the Ansell profit-making chain, yes? So the companies make profit at every point in production, in the plantations, in the factories, in transport, and then in the use in the hospitals. The health workers are at the end of production. They're the most unionized people, but also they've been pushed against because of lots of things. So we would like to talk about, number 1, the conditions for health workers. Number 2, what was the agenda? Sorry. Number 1, the current situation for health workers, the demands that the workers have and their request for solidarity. Then the part of the campaign is linking together with the other workers here. Is that all right? Does that make sense? Now everyone wants to speak. Great.
Yeah, sorry, Manrico, I misunderstood what you wanted to know. But that's how the UK is because of the behaviour of the Tory government.
Stop. So now everyone understands and agrees, yeah?
Make money for their friends. Can you hear me? Yeah. Sorry, okay. Yeah. So the trouble with the UK is the way that the government here has spent billions and billions, literally, of pounds on ineffective PPE contracts. And so workers have been left with unusable PPE, and it took a really long time for it to get into care homes and things. So a lot of people died because there was inadequate PPE despite the billions being spent on it. And it's really difficult here because I think the health workers are under so much stress and the staffing so bad and their wage offers are so low that I think the whole PPE inadequacy is tied up with that as well. So, and it's very hard for, I think, health workers here to be mobilised. They're absolutely stressed. And because there's just not enough staff, and the government's trying to pretend that COVID's all over, but the rates of infection are the highest that they've ever been. There's just fewer people are dying than would have otherwise because of the vaccinations. But in fact, people are off work all the time because they're sick and got COVID. So it's a really difficult situation. So PPE is tied up in that mix, but there's not been specific sort of protests about PPE as such that I'm aware of. I don't know, Brian, are you, or do you know any different, Brian?
No, I think it's a general remarks which you've made, you know, and again, like obviously events around the world, cost of living is going up, taxes are going up in this month in the UK, and they've seen the Chancellor one of the richest person was certainly connected to a very rich family in India, where he's basically his partner has, not saying bent the rules, but not been in the spirit of the rules of basically paying taxes and sort of a domicile status, but despite being living here for X amount of years and married to the Chancellor. I think a lot of it's quite correct. A lot of the PPE which was purchased is on the basis, let's have a full warehouse, not have a full warehouse sort of signs. If you have empty shelves, it looks worse than the full shelves, even if it's some of the items are out of date or will become out of date. And again, some of the PPE has been exported across to obviously Ukraine to help out there with people, all with the medical conditions that people face in Poland, and been injured in Ukraine through the fighting. And in general, the TUC is organising going to have a demonstration set for the 18th of June on the cost of living, but a crisis in the UK facing many people, and we'll wait to see how big that could be, but I'm not quite sure of what their plans are after that, whether or not, for example, to ensure that we have obviously we have a minimum wage, but whether or not to have a living wage campaign or even higher than that, for per hour. We've obviously seen the events of, I think, another P&O. They still can't sell their ships because obviously the events where they sacked a lot of their people and basically made disclosure acts, so they couldn't, and they had 14 days to take the money or lose out. And there is one sort of chef who's now taken them to employment tribunal from that point. We wait to see what happens there, because obviously that is a big test in the UK, the reaction of the government, and if P&O are quite successful in those, then we can see many other multinational companies perhaps considering the same tactic in some format. But at the present, the government has stopped them from sailing their ships in and out of the UK waters to Europe and Ireland, which again has caused a lot of disruption at the ports, and with the movement of freight and also people travelling. So, but health workers itself, I think across the NHS, there's obviously, we're all looking to see what the trade unions, all the trade unions involved will put in for the pay claim, and the government's response to that, which it technically goes to an independent review board, but it's much influenced by the government.
Okay, thank you, Brian. It sounds to me like that the crisis is wider than just health, like it's a bigger crisis. Thank you for this. I need go now to Michael, and then we're going to go to Jonathan. Then we are going to see if people want to make a few statements. Then we will go to the next item, which is Ansell Lanka. And before we finish, we need to talk about the next meeting, because it is important to cover the refugee issues and the bonded labor issue, and we need to know how we're going to do it. So Michael, you're next.
Yeah, thanks. I think just to start off with a bit of context, obviously healthcare workers in Australia are much more fortunate than the vast majority of healthcare workers across the world with regard to access to appropriate PPE. Yet even here in a rich country like Australia, access to PPE during COVID has been problematic. We saw massive shortages straight away with access to masks, which we believe actually helped force the government to take a setting that was not helpful. They said that masks were not necessary for COVID in the first wave, clearly contrary to the evidence. As access and local manufacturing commenced, masks became more available, And as the evidence increased to show that COVID was airborne, we had to fight for nurses and midwives in New South Wales to have access to the higher level of mask, the P2N95s, they're called here, rather than the basic surgical masks, and for those masks to be fit tested. We're now in our fourth wave, and there remain aged care workers in the private sector who are yet to be fit tested and still don't have access to the higher level of the masks. You know, Australia wiped out its manufacturing industry decades ago and is very reliant on the process of, on-demand manufacturing and supply. So as soon as those global supply chains stopped with COVID and the rich European nations and North American nations swallowed up PPE, we were left bereft. We have had a period now of over 10 years with the state government here having a wages policy that said workers can't access a pay rise above 2.5% unless they're willing to trade off conditions. In the face of shortages of nurses and midwives and staffing levels, we've been fighting now for 10 years for increased staffing levels in the public hospitals. The fatigue following COVID, wave after wave after wave of COVID, left us wondering whether or not our members would be willing to fight for better staffing. What was clear was some work through member leader development and agitation in the workplace. We have had our first statewide strike in 10 years in February. 8,000 nurses walked off the job for one shift, and 6 weeks later, so just on the 31st of March, they did it again. So unprecedented for this union to have two statewide strikes within 6 weeks. So I think that shows a lot of hope, and that's actually shifted the government now to concede that they need to talk with us about higher wages and, importantly, more nurses and midwives into the public health system. So whilst not directly related to the topic, I think it's a good demonstration that with proper focus on building member leadership, building agitation and giving workers hope, you can have some quite good impact. So I've just put in to the chat a video for you to watch later from our first strike. Same channel, you can see our latest strike. I'm happy to take any questions.
Thank you so much, Michael. That was very, very well explained. Someone says, who says, Jean-Pierre, is it possible to receive some kind of minutes for this meeting? No, because I am not taking minutes and I don't know anyone who is. However, we are recording this. And when we send out the next invite, which is soon, or the report on this meeting, you will get a link to the recording, okay? So you can watch it and record things. So thank you. Michael is happy to take questions. There's 2 people on the speaking list. Well, there is one person on the speaking list who is Jonathan. Then Stefan already has put his hand up to say something. This is going to be a short time we have now, yes? Because we have to get to Ansell Lanka. We have to talk about the next meeting. I'm sorry about this. I am not making the crises in the world. I am just trying to chase them. So next is Jonathan.
Thank you, thank you, Comrade Chair. I will be brief. I misunderstood your initial introduction to the topic. So just to follow on from Coral's comments and other comrades, Brian and Stefan, in the UK, with a major issue facing health workers is protection against airborne transmission of COVID-19. We've been fighting this battle for the whole of the pandemic now, and still our infection control authorities refuse to give all healthcare workers respiratory protection, in other words, against the airborne transmission of COVID-19. We have lost over 2,000 health and social care workers that we know about. 150,000 plus more have got long COVID. Tens of thousands of patients have caught COVID and died in our hospitals and still they deny that this disease is airborne within the hospitals. It's become so ridiculous that within the education department, the government is providing air purifying devices, never anything near what's required, but they clearly accept that there's airborne transmission in schools. Official government guidance says that airborne transmission is a major route of transmission, but miraculously somehow this stops at the doors of the hospitals. So Doctors in Unite have been working quite hard on this, and we continue to do so. The other encouraging news we have from the UK is that there have been a number of successful strikes by rank and file workers, particularly those who've been outsourced to private companies from the National Health Service, mostly black and brown workers who've been put on temporary contracts or badly paid contracts and poor conditions. There have been several successful strikes where they've been taken back into the NHS, which gives them much better pay and conditions and security of employment. And we're all very encouraged by this. And there are a number of ongoing disputes at the moment, which we continue to support. Thanks very much.
Thank you so much, Jonathan. It was very comprehensive and clear. Also, there are two people, comrades, who are not part of the health worker speakers who want to speak. So I'm going to ask them to speak. I'm going to go to Comrade Gwyneth first because she hasn't made a comment first. So this is called progressive speaking list. And then I'm going to go to Comrade Stefan. And then I have a question for Comrade Michael. And then we're going to the next item. Hey. Okay, Comrade Gwyneth.
Thank you, comrades. I just wanted to add to the reports that we have had to date, and they are limited by the people attending, etc. But when we are looking for the next meeting, I think that we need to recognise and remember that the nurses in Malaysia have been taking industrial action about the health and safety issues, which include PPE, of course, but not only PPE, also staffing levels and all of those issues that are important throughout. And also, and so it's not only been here in Australia, but in other parts of Asia who have been very much involved in this, and it would be good if we could get a report from that. And also there are allied health workers who are also taking industrial action in these. So the support from this campaign should go out beyond just the nurses throughout the whole of the health industry. Thank you.
Thank you, Comrade Gwyneth. Next is Stefan.
Yeah, I'd like to just follow up on what Brian said about in the UK. I agree with his comments. I'd just like to add that a couple of weeks ago there was supposed to be a national demonstration against the Conservative government at the Tory party conference in Blackpool in the north, on the coast in the northwest. The TUC cancelled it literally overnight, and basically said that they were going to organise a national demonstration in London, which happened yesterday, in support of Ukraine. A number of trades councils, including Rochdale and obviously Blackpool, decided to go on with the event, which we did. But it was obviously quite an embarrassment to the TUC, both in the region, Northwest region, and nationally, because what's really happened is that regarding Ukraine, both the TUC and the Labour Party have basically jumped into bed with each other and having some kind of like national unity, and rather saying, like I say, I participated with you, Manrico, in the conference that Jean-Pierre participated on, and obviously we're saying NATO troops out of Europe, ceasefire, withdraw the troops and whatever, no support to Biden, Johnson, you know, and no to national unity or sacred unity, because the Labour Party and the TUC have dropped all opposition to the government. And people probably, well, you know, might well know that in Britain, the Tory governments now have dropped all free testing for COVID. And even though this new variant is much less damaging in the sense of, you know, can actually kill you, the NHS is under increasing pressure with a number of patients that have been admitted into emergency wards and whatever, even though many of them will not die, and they do have some kind of medication now, which is really potent. But the point is, you've got a situation where all these things are still happening. There's still a crisis, a COVID crisis. The NHS is still under massive pressure. The Tory governments are going ahead with systematic privatisation of the health service, and yet the Labour Party and the TUC, because of the Ukraine crisis, invasion by Putin, have basically dropped any kind of pretense to oppose the government and all these issues. And unfortunately, that's the way it's standing now. And of course, people like myself and the Trades Council and whatever are obviously opposing this and saying, you know, this is all wrong. You cannot drop all this opposition to governments on all sorts of issues, particularly health and COVID and the crisis in the NHS and privatisation, simply because you're trying to form some kind of national unity with the government over the question of the Ukraine. So that's what I'd just like to add to the comments of Brian about what's happening in Britain.
Thank you so much. Okay, so as we look into the problems become more complex rather than simpler. But anyway, we have to move to the next item. There's no one else with their hand up. I want to ask a very brief question to Michael, if that is okay. And the issue is this: right from the beginning of this campaign, nurses and health industry workers, but particularly the nurses union from Victoria, have supported the campaign. But they have had limited ability to provide solidarity because of the pressure that they've been under because of the COVID situation. Basically, they've been constantly under pressure. Now, the New South Wales nurses have been taking industrial action. I just would like to have an idea if what we've been thinking in the campaign, that we should be looking towards the health workers for solidarity. Like, is that a good plan? Like, it is very clear that in the PPE industry, that is where the union strength is. There is no question. But it is also potentially clear, not sure, that the focus of those unions is basically survival and dealing with their crisis. And they may not have, basically I'm asking, how do we make solidarity links in this situation of many crises and very uneven ones? Yes, so I think I accept that what Michael said is the situation for some people is very different to the situation of the other. I hope that's clear, my questions.
Yeah, I think when I was last involved in this campaign, looking at the supply chain issues for healthcare equipment and the Ansell question, the issue for nurses and midwives and our union, whilst we would be happy to be re-engaged around the issue to draw attention to it, the actual ability for us to create any boycott or any pressure around the company in question is limited to calling them out. The nurses aren't, they don't work with the procurement. They can't put pressure on in that way. We tried earlier to get one of the other unions involved, the unions that cover healthcare workers other than nurses and midwives, and attempting to re-engage those unions, I think, would be a positive step. I'm not sure why they dropped off, but of course, any resolutions that you can get to us, I would be happy to take to our committee of management.
Thank you. I want to, so I accept what Comrade Winner said, that we haven't got the Malaysian nurses union in the meeting, and they've been doing a lot, and they did a motorcycle cavalcade across the country to raise their issues. So possibly we need to continue the, and it looks like the health industry question is very important because it is so linked to all the other aspects of society in crisis and production lines and these questions. So we may need to look at continuing the discussion on health workers while we're having the discussions on the other area. But this is going to be very, very soon. Right now we have to go to the next item on the agenda, which is the Ansell Lanka. Unless anyone says they want to say something more on health workers, I would like to do that. Okay, we're going to go to Ansell Lanka. So Comrade Sylvester said, I don't see any Ansell workers in this meeting. That is correct. The reason we haven't got any Ansell workers in this meeting is because of the problems in Sri Lanka. So they haven't been able to get money to buy phone cards to get internet connection, and then they don't have enough power to be able to join the meetings, and they don't have enough money to eat. So we've been, some comrades in, I think, John in the Unite has been helping for them to get the mobile cards, but the reason they are not here is not because they are not interested. They've been involved in all the meetings. So since Comrade Sylvester fell ill with dengue fever, they have been involved regularly. We have sent the invite to the Free Trade Zone Union and to Industrial to participate in this meeting, but they are not in this meeting. We asked Comrade Gemma from Unison, who has been involved with Industrial negotiating with Ansell, how things are going, and there is no response from Ansell on the actual demands. That's the last thing she said to me. There's no response from Ansell on the actual demands in the Ansell factory in Sri Lanka for the reinstatement or compensation of the workers. So we don't know. So we don't know two things. Number one is what's happening in Ansell Lanka. Like Ansell talks a lot about them being very good and listening and remediating bonded labor and slavery and denial of rights here and there, but that is just words. In the actual demands, they are not giving anything. That is the situation we see. In the contractor factories, they're giving nothing. That is the situation we see. The only things they give is when the governments push against them, and the only time the governments push against them is because of a huge publicity against them. So we would like to talk about why Ansell Lanka is not moving, and also how can we push against Ansell Lanka? Is it possible to push against this company? So I don't know if Comrade Sylvester, you have anything to say on this. You can say if you like, because your union is industrial affiliate.
Yeah, actually, I don't know whether we have taken the matter up with the ILO, because the ILO is the body that has to see overall situations in the world of work. So if the, as you know, the industrial has Anton Marcus as their executive committee member from Sri Lanka, and we find a lot of things. We are at loghead with Anton Marcus in our industrial council meetings also, because we don't see eye to eye with him on a number of matters. So if we can bring it to the notice of the ILO as well, the situation that is prevailing with regard to the Ansell workers, because here the Employers Federation, the Labor Department, the ILO representatives, they are going on the basis that all industrial laws are being applied, and the country, the government is, the Labor Department is following labor regulations. So we have to bring it to the notice of the ILO as well, that this is the situation, and now the unfair labor practice issue is been canvassed in the labor department as far as the Ansell workers are concerned, because after joining the union, and the union leaders have been subjected to harassment and not only harassment, also repercussions that are against their own lives also. So I would suggest that we take up the matter or write to the ILO as well to take up the issue on a broader basis.
Thank you so much. So the proposal is that your union writes to the ILO. Is this the proposal, Comrade Sylvester?
No, I think as a joint body, you can write to the ILO on behalf of all of us. I think I don't know whether it is possible. If it is not possible, we ourselves can write to the ILO giving the information.
Right. I think the campaign has no standing in the ILO. The ILO is a tripartite body, so it has unions, employers, and the government. I think your union would have standing in the ILO because you are covering the area, because you're part of industrial that definitely covers the area, and you are a union. This campaign is not a union, and even AAWL is not a union. So we have no standing in ILO.
Yeah, I understand. Right.
I think the idea is very good, but I don't think it would work from the campaign. I would like to say, so that is the proposal, right, to try to push forward. I am not really sure how we can manage to get a direct report from industrial or free trade zone union. I don't know how to do that. The question of how to put pressure on Ansell is basically a problem for all of us. Like, they are a very, very, very big company, and they make many, many billions of dollars in profit, and their policy is anti-union. That is clearly their position, you know, anti-union, give nothing. Okay, we don't have other people from Ansell here. It is now we've nearly used up all the meeting. So obviously we will continue the discussion on Ansell. I want to talk about the next meeting, if that is okay. Would that be okay, comrades? Okay. So from where I sit, this meeting has been interesting. It has shown that the crisis is along all of the production line, not just particular sectors, not just the factories. Comrade Jerem wants to speak. Okay, you can speak, and then I'll go to talking about the next meeting.
So it was actually hopefully a quick question to Comrade Sylvester. You said that you have no information except that the Labor Department case is pending, which the Labor Department case has been pending for some years. But is there a date? Do you know that that the next appeal is going to be adjudicated or a judgment handed down? Do you know?
Comrade Sylvester fell out of the meeting. This happens.
That's all right. I might see if I can chase that information up before the next meeting or circulate it. If there's a court date, that can sometimes be an okay occasion to, you know, ahead of that for unions to make statements and write letters and so on. So yeah.
That would be good. That would be good to have that information. Yes. Okay, I'm going to basically put the issue of Ansell Lanka back on the shelf, where we will talk about it again, given our campaign started from this. A number of unions are requesting information in order to do statements. We will follow up on that, definitely, yes. So the next thing I want to talk about is the next meeting, okay? So I am calling this meeting successful. As much as it was under stress from the war in Ukraine and the emergency in Sri Lanka, we had, I think, interesting discussion. To me, I learned a lot. I know it is difficult to get a definite strategy forward for an international group. It is just difficult. But I think that these meetings are providing more knowledge and more linkages between the different people. And we are managing to have a functioning meeting with people from 10 countries and in lots of different sectors. So I'm happy with the meeting. I want to talk about what is the next meeting. So the areas that we discussed in this meeting was plantations, and we didn't discuss it. So I'm going to put them in the chat. So plantation was meant to be discussed. And health industry, we did discuss, but it looks to me that there is a lot more to discuss. Like more sectors, more areas, more potential issues of solidarity. Even leaving aside where the health industry connects with all the other areas of society that are in crisis. So then Ansell Lanka, we did not manage to do anything on. So basically there are 3 items from this meeting which are still worth discussing, and there are the 4 items for the next meeting. I'm just going to put everything in the chat and then ask what comrades think. And then we have to make a decision, and then the meeting will finish. Okay, because some of us have to go to bed here in Melbourne. Okay, so we covered health industry. We did not successfully cover plantations or Ansell Lanka, okay? But as Comrade Gwyneth said, there is more to say about the health industry. And I think from the discussion, there is more to say about the health industry. And in the next meeting, we were going to discuss migrant workers, which Aga talked about already today. The issue of bonded labor slavery, which is happening in contractor factories of Ansell and other companies in Malaysia and other countries. The question of anti-union laws. So we have discussed that the anti-union laws are really part of our problem. They are keeping unions out of organizing, and therefore we're getting all these issues. In Malaysia, they stop organizers coming in where there are migrant workers, so they can't join the union. And the 5th item we wanted to discuss was yellow unions. So here in Southeast Asia, we call non-genuine unions that work for the bosses yellow unions. Yes, there are unions legally, but they're not unions in practice. They behave just for the bosses. They control the workers. It looks to us that in many places, yellow unions is the strategy of controlling the workers. Definitely on plantations, there's a lot of yellow unions, but also it looks like some of the factories, there's yellow unions in many countries. And it's a big problem because it is not being called out by the major genuine unions. You hardly ever hear this because the problem is the yellow unions are inside the international federations. They do political deals with everybody. This is a problem. But, you know, we don't have standing in parliament, in trade union councils or nothing. So we can talk about it, okay? So
Americo, sorry, can I just add to that about the yellow unions, a quick word? In Malaysia?
Yes.
What some companies do is they allow you to unionize, but strictly in-house. So in-house doesn't necessarily mean pro-management, but because they are not allowed to be part of or to form a national union, they don't have the bargaining power that a national union has. So many organizations, they allow you to unionize, but only in-house.
Right. So that would be part of, okay, so that is not a yellow union problem, but it's part of the anti-union laws. These are regulations that keep the unions ineffective. I think that is an important thing to talk about, yes. So my question is, so the idea was that the next meeting was on the 10th of May, which is a long time from now, but that's because in many countries there's Easter holidays now. There's also Ramadan coming up very, very soon. So I would like somebody to say something about these things. Do we put these issues on the agenda? Do people like this type of meeting? Do we put these issues on the agenda and we try to discuss these quite difficult meetings? Yeah, quite difficult issues. Yeah, like they're real issues, but they're not easy. So that is the question to you, comrades. I want to ask Aga first because he was stopped from talking before, and then other people who want to say something.
Yeah, during the next, we're going to for next meeting. I just want to highlight it, not only Ansell and the industry, but here in Malaysia also other companies, warehouses, and that the restaurant industry is also doing same things, and we have highlighted their workers also. So one of the worker who's working at restaurant 3 years, he was legal, but he deprived by company, and the stolen the salary. I think maximum minimum 54,000 ringgit stolen by company, and he is still surviving for the legal help. So I will try to bring him on next meeting. He's Punjabi, and we can translate to English.
Thank you so much. So I'm going to put these two items that comrades have mentioned into the chat as well. So what Philip said, that there is the issue of in-house unions, which are not necessarily yellow, but they are constrained, okay? So they're allowed to operate, but they have little power. And then there is, I think what Aga said is very, very important, that other industrial air sectors are experiencing the same issues as PPE. So we are talking about these issues here, but they are not PPE issues. They are often economy-wide issues, like pressure on wages and workers not getting their rights. And like we sort of, the campaign is talking about issue contained in the campaign, but it's actually talking about issues that are sometimes national issues, sometimes industry issues, and sometimes even global issues. So workers have a lot of problems right now, comrades. There you go. That's what I have to say. Does anyone want to say something? Because then I will close the meeting. I want to know if people like the idea of having another meeting somewhat like this, looking at those areas on the 10th of May. So it's in a month, yeah? So I don't know how many wars start between now and a month's time, but that's what we're looking at the moment. So I'd like somebody to say something on this. Oh, Coral, yes.
Yeah, I think it's a really good, looking from a UK perspective, the issue of migrant workers and bonded labour slavery is also very real in the UK. And of course, it's the same kind of workers that are affected. And there we can tie up here with other organisations that are actually campaigning in the UK with about bonded labour. And I think that will help give an international perspective to it.
Thank you, Coral. Okay, the next person who wants to speak is, oops, they've gone. What happened? Anisua.
Thank you, comrades. To take next agenda, migration. Especially, I am working on labor migration, overseas labor migration, and you are rightly mentioned. Migration is a global issue, and migrants sometimes they are not getting proper support to their destination country. So this platform, I think, a very effective for migrant workers. Thank you.
Okay, thank you. So now what I want to say before no one else wants to speak, so I'm calling it that people are happy with this. I'm calling it that people are happy with the 10th of May, which is another Sunday. We can only have meetings on Sundays at the moment. Workers can't manage to get to other meetings.
So, Manrika, could you just clarify the date? The 10th of May is a Tuesday.
Is it? Fantastic. Okay, I don't know the date. It's going to be maybe the 8th, maybe the 15th. It's around there, yeah? It's after May Day. Thank you, Comrade Jerem. So I want to say that we have to have meetings on Sundays. We have to pick a day when most people have got the day off, because the meeting ranges in time from 8 in the morning to 8 at night. So that it just doesn't work any other time. So that's the first thing I want to say. The second thing I want to say is that with so many items, it's too many items for the meeting. So we are going to think of something creative to do. in AWL. I'll discuss it with the AWL organizers to see what we can do. We did things like using the breakout rooms, which worked a little bit, but we will see. Okay, I don't have any more. Are people happy that we finish here? Okay, so I would like to thank everybody for coming to this meeting. I have found it very interesting. We have a lot of extra information that's been put in the chat. It will go in the report. You will receive a link to the recording. You can do whatever you think best with the recording. You want to put it on Facebook, Instagram, TikTok, show it to your relatives, whatever you want. Yes, it's public. Okay, that's it, comrades. I know a lot of struggle out there. Thank you for coming to this. Best solidarity wishes to everyone. Meeting finished. Thank you.
Thanks, comrades. Thank you.
Bye.
Thank you.
Thank you. Thank you. Bye-bye. Bye, comrades. Bye.
Thank you very much, comrades.